George Floyd. I can't say anything else without first saying his name. George Floyd is now one of far too many who have lost their lives. Pervasive injustices have been hardened into our system over centuries. Too often, people of color pay for these long-standing inequities with their lives. Some in obvious ways, like George Floyd, and far too many whose names we do not know in less obvious ways. Structural racism has created poor outcomes in educational attainment, criminal justice, and of course, health outcomes. In almost every health measure, heart disease, diabetes, cancer, infant mortality, our communities of color fare worse. One only has to look at our COVID-19 dashboard to see these inequalities on full display. In North Carolina, African Americans make up an estimated 22% of our population, yet account for 34% of our COVID-19 deaths. Too many families have lost loved ones. I want you to know that I see you. I see your deep hurt and sadness. I understand the despair and fully support the need to peacefully protest. And I was heartened to see that in the midst of so much pain, many showed their care for those around them by covering their face. However, any form of violence and destruction does not serve our collective goals for justice. My heart goes out to the business owners across the state who are grappling with losses. While we cannot undo the harm that communities of color have suffered, we can act. And I cannot walk in the shoes of any person of color, but I can use my place of privilege and power to do better. One small down payment on that call to action is how we respond to COVID-19 as a state and as a department. Today, DHHS released a request for vendors to help us ramp up testing and tracing efforts. In that request, we are focused on historically marginalized communities. We want to partner with minority-owned businesses and businesses that hire a diverse workforce. And we want those partners to focus their testing and tracing work on those historically marginalized communities in culturally appropriate ways. I want to thank DHHS Deputy Secretary Ben Money, who's here with me today, who leads all of our work focused on historically marginalized communities, and Dr. Cardra Burns, our Deputy Director for Public Health, who is leading our testing work and is going to share more with you today about our testing efforts. Together, they're leading an unprecedented effort to put inclusiveness and an intentional focus on overcoming health inequities at the center of how we respond. Before I turn it over to Dr. Burns, let me thank Monica McGee and Brian Tipton, who are our American Sign Language interpreters for today. And as always, Jackie and Jasmine Matevier are behind the scenes assisting with Spanish translation. I'll now turn it over to Dr. Burns, who's going to share more about our testing and tracing work. Dr. Burns.
Thank you, Secretary. I appreciate your leadership and echo your sentiments. Ahmaud Arbery, Breonna Taylor, George Floyd, and countless others that have lost their lives. I hurt for their families, I hurt for my community and communities of color across this country. Testing and contact tracing are how we can best protect ourselves and our loved ones and slow the spread of this virus. Historically marginalized populations are disproportionately impacted by COVID-19. They face real barriers to these basic disease prevention tools. Everything from implicit bias impacting access to quality health care, lack of trust in the healthcare system, or just being able to access testing in their communities. Our team is laser focused on addressing these barriers and ensuring that our communities of color are front and center in our efforts to respond to COVID-19. It begins with having people that look like us and come from our community doing this work. As we have expanded our contact tracing capacity, we have focused on hiring candidates that reflect the communities they serve. To date, 31% of newly hired contact tracers are Black or African American, and 16% are Hispanic or Latino. Updated numbers will be reflected on the DHHS dashboard on Wednesday. It also means partnering with businesses and community organizations that are led by or have a workforce that are predominantly people of color. The requests for qualifications released by DHHS will create a pool of vendors that can rapidly engage to respond to the COVID-19 pandemic, and we are prioritizing working with these minority-owned businesses. It also recognizes that how we work with people is vitally important. To qualify, vendors must demonstrate racial, ethnic, cultural, and language competencies which reflect the communities they will serve. The first deadline to respond to the RFQ is June 9th, and qualified applicants will be notified on June 17th. This is a rolling qualification process, and vendors will be able to submit a response by the 1st of every month through December. As Secretary Cohen said, it's one small down payment on our commitment to action. As we move toward mitigation of COVID-19 and provide more testing and contact tracing, we must address these root causes without unintentionally harming our communities and increasing these disparities. We must focus on health equity. We know what it takes to build strong communities: access to quality primary and preventive care, affordable healthy nutrition, quality education, and affordable housing. Keeping our communities healthy and safe requires a commitment to providing these necessities. And I will pass it back over to Secretary Cohen.
Thank you, Dr. Burns. And of course, as always, I'm going to turn it over now to Director Mike Sprayberry for his update.
Thank you, Madam Secretary, and good afternoon. And thank you, Dr. Burns, as well, and welcome to the stage this afternoon, I should say. I'm also troubled by the events of this past week. I want to acknowledge the pain and sadness many are feeling right now and look forward to healing, understanding, and peace in our communities. I also want to reiterate the Secretary's comments and those of Governor Cooper and Secretary Hooks from yesterday, that violence and destruction do not serve our collective goal for justice and peace in our communities. Today is day 84 of the State Emergency Operations Center's COVID-19 response. Teams are beginning a third week of distributing personal protective equipment to long-term care facilities this week to make sure these facilities have the supplies they need to protect their residents and staff. This week, we will distribute PPE to long-term facilities in 41 counties from 6 distribution sites in Boone, Morganton, Bolivia, Kinston, Red Oak, and Lumberton. Our partners with the Office of Emergency Medical Services, the National Guard, the Civil Air Patrol, and our state and local emergency managers have been doing great work planning and operating these distribution events, and we thank them for their excellent service. Today is the first day of the 2020 hurricane season, and North Carolina has already seen impacts from 2 early storms, Arthur and Bertha. Now is the time to make sure that your family is ready for the season. If you've never had an emergency kit or you just need to refresh yours, visit readync.org for instructions on building a kit and creating a family emergency and communications plan. And this year, to stay healthy, make sure you include hand sanitizer, face coverings, and sanitizing wipes in your kit. And if you live in a coastal county, you'll want to visit our new Know Your Zone website to see if you are in a predetermined coastal evacuation zone. Officials in 20 coastal counties have developed these evacuation zones to simplify the process of ordering evacuations if there are needed. Visit knowyourzone.nc.gov to enter your address and learn your zone. That's knowyourzone.nc.gov. North Carolina is holding a day of mourning today for the more of 100,000 COVID-19 victims across the United States and nearly 1,000 victims in the Tar Heel State. Please remember all the families who have lost their loved ones and keep them in your thoughts and prayers. Remember to observe the 3 W's, wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. With these simple yet effective tools, we all have the ability as individuals to slow the spread of the virus. You have that power. As always, and especially now after this weekend, don't forget to look out for your family, friends, and neighbors. Call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we're going to get through this together as one team, one mission, and one family. Thank you, Madam Secretary.
Thank you, Director, and now we'll open for your questions.
We'll ask our reporters on the line to press 1 if they'd like to ask a question, and we'll take our first question from Jim Morrill at the Charlotte Observer.
Oh, hey, Secretary. Thank you for taking this. I just wanted to see what your reaction is to the latest request from the Republican convention organizers to put 19,000 people in the arena with no mask and no social distancing. Do you think there's any scenario in which you would ever approve that?
Jim, thanks for the question. As you know, we've been working hard to slow the spread of the virus. And as we sit here almost 3 months ahead of late August, we really don't know where our state will be in terms of viral spread and what we could be facing at the end of August. What I've asked back of the convention organizers, as I've asked other folks who have holding larger venue events, is to share with us a plan. And that plan should have options in it because we don't know what will happen at the end of August. So similar to NASCAR, who submitted us a detailed protocols of how they would handle their event, the Coca-Cola 600. They submitted that plan to us. Our public health team was able to review that, give them some additional suggestions, and they were able to execute a very good event that was enjoyed by millions on television. What we know about the spread of this virus is that when you are indoors, close together, without 6 feet apart and without face coverings, the virus spreads. And so we want to work with folks to understand how are they going to move through a convention event, but make sure that they are not going to have virus spreading either to convention participants, but obviously also to the larger community of Charlotte and beyond. So we look forward to continuing to work with them and await their plan on how they're going to move forward. Thank you.
We'll take our next question from Victoria Bulabasis with Enlace Latino NC.
Hi, good afternoon, and thank you. As today is the first day of hurricane season, I'm wondering what the plan is for evacuation shelters if we're still facing the threat of COVID, especially in our rural communities.
Thanks for that question. And of course, I think we now have to plan for hurricane season differently in the context of COVID-19. And why don't I turn that over to Director Sprayberry?
Yes, thank you for that question. We're in the process of stockpiling PPE for shelters as needed. We're also encouraging our local partners to ensure that their folks have PPE, and we are encouraging people that may need to evacuate to have PPE in their kits, in their emergency kits. We're also been working with hotels to get a list of them that would be willing to serve as non-congregate shelters. That means places where we could put evacuees and keep them separate and maintain that social distancing to make sure that we are keeping folks safe and giving them a place to stay. We're also looking at larger places to where we could spread out and also maintain social distancing. As you might imagine, having an evacuation to shelters during a COVID-19 pandemic presents unique challenges for us. And so we're trying to expand the number of places that we can actually shelter, But that also brings challenges with staffing. So we're also working and taking a look at where we could get additional staff to come help us man the shelters. We're also working closely with our volunteer organizations active during disasters to not only help us man shelters, but also to ensure that the people that were in the shelters can be fed. So working on a lot of these different things, looking at maybe some contracting as well, and looking at vacant schools, dormitories, and things like that, so that we can basically have the whole array available to us as we have to make plans for evacuation. Thanks for the question.
Our next question is from Travis Fain with WRAL TV.
Yeah, thank you for taking my question. Travis with WRAL. I'm interested in how high levels of concern we ought to have as far as COVID-19 spreading amongst protesters and law enforcement. If you could speak to that, but also, you know, we're several weeks out from various reopened protests. Is there any evidence that anyone involved in those protests, whether in North Carolina or in other states, passed the disease, got the disease, or have we seen any increase amongst law enforcement, either because that or simply because they have a job where it is difficult to social distance and where they're in contact with the public? Are we seeing anything in our tracing that points to these things as spreader events?
Travis, thanks for the question. First, let me say, as I mentioned in my remarks, I was heartened to see a lot of the folks who were protesting over the weekend, they were wearing face coverings. And so I was appreciative in the context of all of the pain and anguish of the weekend that people were taking that act of care and kindness to protect the world from them and to wear those face coverings. So I largely did see a lot of face coverings, not everywhere. And so again, to remind folks that face coverings is one component of our 3 W's, and it's really important to wear a face covering, but also important to keep your distance and to wash your hands. So I think all of those are important in concert together. We will have to wait and see if the weekend's events cause more spreading of virus. I think anytime there are more people who are in closer contact, even when they're outside, I think that is a risk. As I look back to other protest events like Reopen, I'm not aware of anything that has come to light through our contact tracing, though I'll go back to our team and see if there's anything that we have been able to identify. But that's again why we need to continue our vigilance. The hard part about this virus, we don't know who might be what's called a super spreader and cause virus spread to many tens or hundreds of people in one outing. But that's exactly the kinds of things we're trying to avoid with all of these actions that we're taking to make sure people are socially distant, that they do cover their face and do wash their hands. So we'll keep our eye on this. And I would say that, look, over the weekend, I know a lot was going on, but we also had our highest day of new cases here in North Carolina over the weekend. And so the virus is here. It's in our communities. It's going to be with us. And so we need to all work together collectively to keep that spread of the virus low. Because what can happen if we don't do that is we could see an acceleration of viral spread, and that could risk us overwhelming our medical system. I think we're in a much better place than we were just a few months ago when this all started in March. We now have worked incredibly hard to get the protective equipment we need. We've worked hard to really ramp up our testing effort, and you heard from Dr. Burns about how we're even going further on that. So we're in a better position to respond than we were back in March. So that's a good thing, but we all still need to work together to keep that virus level low and that spread low. So thank you for following your 3 W's as we go here. Thanks, Travis.
Our next question is from Carrie Travis with the Carolina Journal.
Hi, Secretary Cohen, and thank you so much for taking my question. Travis Fain hit on this a little bit, but I am thinking about these protests in terms of people wearing face coverings, but still being closer together than that 6-foot measurement, still shouting. We've talked about how shouting can sometimes, emit some, more viral spread. So even so, would you recommend or discourage protesting altogether at this juncture?
Well, we want to make sure that folks can have their voices heard. I think what we saw over the weekend was folks wanting to be heard. And I think I shared in my remarks just earlier that I want folks to know you are heard, you are seen. We take that very seriously. And I will say, in my role in terms of leading our response to COVID-19, we want to use this as an opportunity to act now and make sure that our response is really focused on overcoming these structural inequities that have been part of our system and have resulted in disparate health outcomes for our African American communities, our Latinx communities. So we know that as we respond, we need to do better. So first and foremost, want folks to be able to express that frustration and pain. But we all want to do it in a way that protects each other. And that's why it goes back to saying I'm thankful that folks were doing that and they were covering their faces while doing it and staying socially distant. Not everyone. So we could always do better. And I'm thankful for those who were heeding that call, but we always need to do better. We have to balance all the things that are happening in our communities right now, COVID-19 and racial inequities. And we can respond to both. And I think we can, as you're hearing from my team, use this moment to act differently and build a stronger North Carolina as we go forward, and that's what we're focused on.
Our next question is from Lynn Bonner at the News and Observer.
Thank you very much for taking my question. This is Lynn Bonner from the News and Observer. I'm wondering if you've seen any spikes from Memorial Day activities or from any phase of the reopening. And if you have, are those spikes in cases, hospitalizations, or deaths?
Thanks, Lynn. So what we've seen over the last couple of weeks is both an increase in our day-over-day new lab-confirmed cases, and we have seen a slight increase in our hospitalizations. Last week, we were seeing hospitalizations that were in the low 700s. If you want to remember back a few weeks ago, we had largely been holding in about the mid 500s in terms of total number of people hospitalized across North Carolina. And then we did see an increase to 700. We've come back down now, and I think we have 650 people currently hospitalized. So we're watching that very closely. The good news, as I was mentioning before, is we have capacity in our system. We have the ability to respond in a much stronger way than back in the middle of March and the end of March. So those are good things. So we are seeing new, like I said, larger new cases, in our lab confirmed cases, and we're watching that very closely. You can see and follow along on our dashboard. We have a map of where those are. We have information down to the zip code level. And what I'd say is there is not one spot that I'm seeing across our state that is the trigger point or the place that we really need to watch. There's a number that I think we need to watch that are small increases that could be a harbinger of something coming in the future. And that's why we want to watch trends. It's never one day that we want to overreact to, but we want to see what those trends look like over a period of time and make sure that we're acting. All the things that it comes back to is, again, slowing viral spread so we don't overwhelm our healthcare system. And it's the basics. We're going to come back to is the 3 W's again, wearing a face cloth, washing your hands, waiting 6 feet apart. As far as Memorial Day, we're not far from Memorial Day. Usually it takes about 2 to 3 weeks to see any impact from a particular isolated event. And so we'll obviously keep looking at our trends, but right now we're not seeing any one thing that we could point to. What we are seeing is a slow increase in various parts of our state, and that's what we are going to keep our eye on as we go forward. Thank you.
Our next question is from Claire Donnelly with WFAE Radio.
Hi, Secretary Cohen. It's Claire Donnelly with WFAE. We have seen some officials in other states recommend that protesters who are out this weekend go and get a coronavirus test. Is that something that you would recommend?
Thanks, Claire. I have not heard that. So, what we are recommending in terms of testing are two things. If you have any symptoms, right, fever, cough, muscle pain, change in taste or smell, you want to go get a COVID-19 test. Similar, if you have a known exposure, if you have a close contact to a known exposure, meaning someone in your household or someone who you have been in close contact with is known to be COVID-19, then you want to go get a test. In addition, we want to be sure that when you are visiting your doctors, we want your doctors to be thinking about the kinds of work that you do. So are you a healthcare worker? Do you work in long-term care facilities? Are you working in a grocery store, like high exposure settings? Then to also think about testing. So we're not saying to folks, just because you did something outside and you might have been close, to go get a test. But if we do hear about someone having a positive test that you may have been in close contact, then we would absolutely say, please go get tested. So we still want testing to be focused on symptoms, focused on exposure, and focused on those higher risk populations, both that are over 65, have chronic diseases, or are some of those workers that have more risk of exposure themselves. So that's the universe of folks that we're saying to get tested. Of course, if anyone has been to a protest and has some symptoms, call your doctor and get tested. Thank you.
Our next question is from Christy O'Connor at WBTV.
Hi, Dr. Cohen. I was wondering, if the virus does spread during some of these demonstrations, how do you go about contact tracing when so many people are in one place and they may not know each other?
Christy, what a good question. And right, that is the work that our contact tracers try to do. For any events, they'll go through your calendar and try to understand who have you been in close contact. And again, that means within 6 feet for more than 10 minutes of time. And so in other types of scenarios in the past, for very infectious diseases like something like the measles, if someone was in an area where there could have been a lot of people, we have to use other channels to get in touch with people. We might not have known who has been in a particular location. You might remember back I believe it was this winter, where there was a suspected measles outbreak, and someone was at a coffee shop in I believe the Durham area, and then we needed to tell folks more publicly to say, hey, if you were at that place during this period of time, you may have had an exposure. So often we are able to do that contact tracing person by person, but if our public health experts feel like the exposure was warranted, that we need to do further and we don't know how to contact everyone, we do use other tools like putting out alerts through the media and in other ways. So we hope not to need to do that, obviously, in this case, but we always have that as a tool if we need to be able to get in touch with folks. Most importantly, I think anyone who was in a setting that may have been higher risk is to be monitoring your own symptoms. Obviously, if you have any fever, if you have a cough, if you have a taste and smell change, make sure that you are either going to our website to look up a testing site. I believe we have over 400 testing sites across North Carolina now that is on our website. There's an interactive map that you can go to, or call your healthcare provider, your doctor, your nurse practitioner, or other person who can help you navigate in terms of what to do next. Thanks.
And we'll take our final question today from Richard Craver at the Winston-Salem Journal.
Hello, Secretary. This is Richard Craver at the Winston-Salem Journal. I know you were asked about in terms of cases since Memorial Day, but in Forsyth County, we've had at least 10 or 11 days of an increase in cases of 50 or more since May 8th, since phase 1 began. And I want to see if you think it's too early to determine if there's a cause and effect there, or it's just increase in testing.
Richard, thanks for that. You were a little muffled, but I think you said we've had a number of days since moving from phase 1 or phase 2 of days of new cases. And do we think that's related to testing, or is there some other explanation? And the short answer is we don't know. We are doing more testing. I mean, we are more than doubled the amount of testing we were doing 4 weeks ago. We're doing 10, 11, 12,000 tests a day, which is great. And so when you're going to test more, you're going to find more. So that's one, we certainly know. And we are also targeting our testing efforts at higher risk populations. For example, we are doing a ton of testing in our long-term care settings. We're doing a ton of testing around meat processing plants and other high-risk settings. So we are also targeting that testing to places where we are likely to see positives, and that's a good thing. So we are testing more, but we also know that we are moving around more. So we have data that shows that we as a state are moving more, and anytime folks are moving more, that means the virus is moving with them. Right? So I think it's exactly why we need to be vigilant in this moment. We want to keep the virus level low so we don't have so much virus spread that we are going to come anywhere close to overwhelming our healthcare system. And that's really what we're on the lookout for. So we'll keep looking at our numbers. Like I said, highest day of new cases on Saturday. As I look around the map of the state, I know you're in the Triad area. The Triad is one of the places where we are watching closely because of the number of new cases we're seeing there. But there are spots in all parts of the state, west to out east, that I think are having increases in the number of cases. So it's time for us all to remember the 3 W's and make sure that we are taking the care that we need to, that the businesses are following the guidance that we put out and are doing the social distancing and the disinfecting. All of those things matter. Each and every one of those actions builds upon itself. So we're going to keep following the numbers, and we'll be back for a briefing. I know later this week we'll go through the numbers in more detail at that point, and we'll keep watching them. All right, thanks for everything that everyone is doing. I want to thank Dr. Burns again for joining us. For Director Sprayberry and I are always here by ourselves. It's nice to have Ben Money and Cardra Burns with us, so you can meet some other members of the team that are working incredibly hard on these efforts and the COVID-19 response. Okay, thank you so much for the attention. Stay well.